Hi, I'm Phil.
Hi, I'm Esther.
So today we're going to do a video on heel pain, and specifically the question we're going to answer is, can orthotics help for heel pain? So Esther, we see a lot of heel pain. Have you seen a bit of heel pain lately?
I have, yeah.
Yeah, it's a really common condition. We, on average, when normal, I don't know what normal is anymore with COVID, but normally we would see 5 to 10 cases a day, and that's about right. I mean, we've had a bunch today already, so it's a common thing that we see.
Yeah.
So Esther, what is heel pain? What is it? What causes it?
What causes it is basically, as you can see the picture behind us, it's inflammation of the plantar fascia, which it originates on the heel and then it inserts on the bases of the toes.
Yeah. Under the digits, yeah.
The digits,
Yeah.
So sometimes it's caused by too much tension on that plantar fascia, and it causes that heel pain there.
Inflammation, yeah. And inflammation, I mean, that's just a fancy term for swelling, right? So if anything in our body gets injured, it will swell. It's the body's way of trying to heal that area. It sends all the good stuff, all the blood flow, which has, all the nutrient and all the basically elements that heal the tissue. So our bodies are pretty amazing. They want to get better.
Yeah.
We find though, for this problem, it doesn't get better for some people.
No.
And a lot of that comes down to a fancy term called biomechanics. So biomechanics meaning the mechanics of the body or of a living thing. So what's something that you often see, Esther, that is happening in the foot that can cause this, or at least make it hard to get rid of?
Okay, so I've got a model of the foot here. I'll use Phil's hand as a platform here. So what happens is that if we have the wrong biomechanics, what the foot generally does is that it collapses like this. So it flattens out like that, causing strain on that plantar fascia. And sometimes, so that's what generally happens.
Yeah. So there's some feet when we see people come in and they take their shoes off and we can see their foot is just flat, like it's collapsing.
Yeah.
And what does that actually do? Can you explain what that does to the actual plantar fascia, that fascia under there? What does it do to it?
So it basically creates tears in the plantar fascia because it's been put under a lot of strain. Stretching it. So
I mean, it's a thing we see a lot, and one thing I would say is when people get this problem, often what they're trying to do is either just get rid of the pain, so they might take pain medications, they might try and get a cortisone injection to reduce the swelling, which that all makes sense because it will help with the pain. Another thing people will do is try and add little cushioning, squishy things under the heel, which that for some people that can help. But one thing we know for sure is if you've got a foot that is doing the wrong thing, if it's collapsing down, it's going to keep putting that strain on. And what's a treatment option that we can use that will be really helpful with that?
So one of the treatments that we use would be orthotic therapy. So it's making
one of these.
like one of those. So it's custom made to the patient's foot. So it helps with preventing the arch from collapsing and then reduces the inflammation of that plantar fascia.
We might even, if I borrow this foot, you can sort of see even the way it will actually get the foot and it'll prevent that medial collapse. So it actually helps to hold the foot in that position. And just this week I've used it for people in their work boots for work, for people athletes, running. A lot of people are running a lot more than usual because they can't play their sport. So these are an option. And this one's really cool. You can sort of see, oh no, you probably can't see. Oh, look, if I zoom it up, you can see there's some texture to the actual material. That's because it's a 3D printed orthotic shell. And so we're really into the high-tech stuff. It's been around for a few years, the technology to do 3D printing, but the last 18 months to 2 years, we've really started using 3D printing a lot more because it's super accurate. It gives us really precise control over the design of the orthotic. So that combined with a nice, cushioned cover. So this orthotic here is the sort of thing we'd use in maybe a pair of joggers or something like that. But the materials and design completely depend on your injury and your footwear and what you're doing in the shoes. So it's not one size fits all at all. It's very, very customized. So if you're at home wondering, will orthotics help for my plantar heel pain? The answer is probably yes. It does depend on what you've tried before, but if you come to see us and you have plantar heel pain, that doesn't mean that you'll get orthotics, because we'll actually treat you as an individual and work out what's best for you. Yeah. We have heaps of other treatment options, which we've done 1,000 videos on before.
Yeah.
But if you haven't tried orthotics, or if you have tried them before and they haven't done what you'd hope they would do, come and see us and we can help work out what's going wrong, why it's happened, and a treatment plan to fix it. But,
yeah.
Hopefully that's been a helpful video. Thanks for watching, and we'll see you all another time.
See you.
Bye.
Bye.